let's talk about something important: the myths surrounding eye health. There are countless misconceptions out there, and my goal is to clear them up so you can have a better understanding of what really affects your vision. You see, there are a lot of things that we have been believing for years. Many of these myths have been passed down through generations, from parents to children, and it's time to set the record straight. In this video, we'll tackle some of the most common myths about eye health and uncover the truth behind them. It's essential to dismiss these misunderstandings so that you can focus on what truly matters for your eye health. Let's dive in. Let us proceed through this chapter by talking about and clearing the common myths. Myth number 1. Not using glasses will damage the eye. As you know, I've already clarified this in the previous video. This is not true. On the contrary, research has shown that using glasses can further deteriorate vision rather than healing it. Our eyes can heal themselves naturally if they are given the proper attention and care. A combination of eye exercises, proper nutrition, as well as common sense can go a long way in naturally healing vision problems. Myth number 2. Consumption of carrots can heal vision. This is yet another myth. Carrots are a rich source of vitamin A, and vitamin A is indeed a requirement of our eyes. However, it is commonly believed that eating lots of carrots can improve the eyesight. This isn't true because the quantity of vitamin A that is required is very little, and it can be absorbed by consuming a healthy diet in general. Actually, this myth is a conspiracy theory that dates back to World War II. During World War II, the British government promoted the carrot myth to mislead the German military and encourage the British public to consume more locally grown produce. Check out this short clip from Vusi Thembekwayo.
Hands up if mom and dad ever told you to eat your carrots because they would be good for your eyes. Hands up if you do know that that's nonsense. Yeah, it's rubbish. There's no scientific evidence linking the consumption of carotene to the quality of your eyesight. Yet, all of us here were raised with that same fable. Where does that come from, by the way? It comes from World War II. A pilot called Sir Ian McRobertson was flying for the Royal Air Force Navy. He used to love eating carrots. He flew only at night, and he would come down having shot down more Nazi planes than his compatriots. And everybody was wondering, how does he do this? He wasn't allowed to tell them that he was given a little piece of kit that today we call radar. It's that thing when you're watching a movie, it's a little blip screen that goes beep, beep. He was the first guy that had it. So he went out, found the Nazi planes and shot them down. Came back, and because he wasn't allowed to tell anybody else that he was shooting these planes down, they saw him eating a carrot today. So they thought he's got Superman eyesight because he eats carrots. This is a true story. And the fable started in 1943 that eating carrots is good for your eyes. And some of you here today will go home and tell your partner, did you know that eating carrots has nothing to do with your eyes?
Myth number 3. Nothing can be done to prevent loss of sight. This is among one of the most discouraging statements that are circulated around, especially from doctors. You hear them say, your glaucoma or whatever eye defect you have is incurable, that you're going to live with it your entire life. That's anathema. Remember when I said that the patient hears the doctor's verdict as a criminal hears his death sentence? Nothing could be further from the truth. Let me tell you this. Your eyes are a set of wonderfully crafted organs, and given the time and care, they can heal themselves. Myth number 4. Eyes can be transplanted. This is not true. No matter how advanced medical science becomes, this is something that will remain impossible. The eyes are connected to the brain through the optic nerve, which is a collection of millions of nerves. Once the optic nerve is severed, there is no way of connecting these back together again. This is why during surgery, the eyes are never taken out of the socket. On the other hand, the cornea in the eye has undergone numerous transplantations over the years. People tend to confuse this corneal transplant with an eye transplant. Corneal transplant is possible, eye transplant is not. Myth number 5. Wearing contact lenses prevents nearsightedness from worsening. Contact lenses, like glasses, are not a permanent solution to eyesight problems. They only provide a temporary method to correct vision, and they are not able to heal or improve vision conditions in any way. On the contrary, wearing contact lens exposes the user to many risks as follows. 1. They can cause dryness of the eyes. 2. They can result in corneal scratches. 3. They can cause corneal infections. 4. They can cause the shape of the cornea to change. 5. They can cause eye inflammation. 6. They can cause eyelid inflammation. The lens solutions can result in an allergic reaction. As stated earlier, many of the myths surrounding eye health have been passed around for generations. Often these are based on misunderstandings or outdated information. By debunking common myths and focusing on evidence-based practices, you can work towards having better eye health. So with that, let's delve to the next video.